You want to be her best lover, not just once, but over and over. The kind of partner who makes her relax the second you touch her because you actually pay attention to what her body likes. Let us talk, plainly and kindly, about 5 things many men do with good intentions that women often do not enjoy, and what to do instead so everything feels better, closer, and more satisfying for both of you. I'm Dr. Fiona Grey, men's health expert. Quick heads up. I've linked my 2 favorite natural supplements for erections and stamina in the comments. They're genuine game changers, and I'll explain why at the end. Now, let's begin. First, going in too hard, too soon with your hands. When intense internal stimulation happens before her body is ready, the pelvic floor often tightens on reflex and her brain shifts toward protection rather than pleasure. Research on sexual arousal shows that comfort, relaxation, and a gradual build raise lubrication and decrease guarding, while sudden intensity early on increases tension and reduces pleasure. A better approach is to warm the outside before the inside. Use slow, broad touch on hips, inner thighs, belly, chest, and vulva, and bring a generous amount of high-slip lubricant in from the start. Ask simple questions like more or less, and softer or deeper. Then build gradually. Think simmer, not sear. Second, skipping or rushing foreplay. For many women, what you might label foreplay is already sex. Arousal for many women follows a curve, not a switch, and modern models of women's sexual response highlight safety, time, and steady attention to external and clitoral stimulation as key predictors of satisfaction. Large representative surveys consistently find that only about 1 in 5 women climax from penetration alone, while many more climax reliably with direct clitoral stimulation or with penetration plus clitoral focus. Translation: plan for more warm-up than you think, especially on stressful days. Keep rhythm steady and change only one element at a time so her nervous system can settle into what feels good. Third, ending the moment right after you ejaculate. Many men feel their energy drop and want to rest. That is normal. Women's arousal often lingers. Studies of touch and bonding show that close physical contact during and after intimacy increases bonding hormones such as oxytocin, which helps explain why immediate withdrawal can feel abrupt or even like emotional whiplash. You do not need to power through fatigue. If she still wants more, continue with your hands or a small external vibrator while you hold her close. If she is content, shift to skin, quiet words, and breathing together. Aftercare is not extra, it is part of great sex. Fourth, putting pressure on her to orgasm. Even well-meant questions like, "Did you come?" can feel like a performance check. Performance pressure raises stress chemistry and makes climax less likely. Research on women's sexual experiences shows that connection, presence, and feeling wanted often matter as much as any finish line. Replace goal-focused talk with sensation-focused talk, such as more like this, stay there, or softer or firmer. If an orgasm happens, wonderful. If it does not, the experience can still be deeply satisfying when she feels safe, attended to, and unhurried. Fifth, assuming you know or gently pushing past a no. Bodies vary, and the same person's preferences change with cycle, stress, and mood. What worked for someone else may not fit this partner today, and what worked last week may not be the move tonight. Communication research across long-term couples shows that clear, low-pressure guidance improves satisfaction and reduces misunderstandings. One respectful question changes everything. When sex is amazing for you, is it usually more from clitoral or external touch, from penetration, or from both together? Suggest, do not insist, and honor any no immediately. A few quiet upgrades make a big difference. Use lubricant early and often. Clinical guidance supports lubricant for comfort and improved experience even when natural lubrication is present. Breathe slowly and lengthen your exhale. Paced breathing studies show longer exhales increase vagal tone and reduce stress, which helps the body open instead of brace. When she likes something, keep one variable steady, so her brain can track it. Tiny adjustments beat constant switching. Blend stimulation rather than choosing between penetration and clitoral touch. For many women, the most reliable route to orgasm combines both. And plan aftercare on purpose, even for a minute or two. Many women remember that warmth and closeness most vividly. If sex is painful, dry, or sharp, pause and get help. Pelvic floor tension, hormonal changes, vulvar pain conditions, endometriosis, infections, and postpartum healing can masquerade as a mismatch. Pelvic floor physical therapists are excellent at teaching relaxation or strengthening where needed, and clinicians can address dryness, pain, or other medical drivers. For men, if erections are frequently unreliable or morning erections have faded for months, that is a health signal worth evaluating. Major medical societies recommend checking blood pressure, cholesterol, blood sugar, sleep apnea, medications, mood, and testosterone in the right context, because erection difficulties often travel with these conditions. Treating root causes alongside better technique is the winning combination. If you want a simple line you can use tonight, try this. Let us go slow and make this feel amazing for both of us. Tell me if you want more of anything, less of anything, or something different. I love hearing what you like. Then prove it with your hands, your breath, your pace, and the way you end. When you listen to her body, build arousal gradually, blend the right kind of stimulation, and keep connection alive after the peak, you will feel the shift immediately. Less pressure, more pleasure, and a partner who is excited to be close to you again. As promised, here is how natural support can fit into a bigger plan while you build great habits. Organic watermelon extract with L-citrulline supports the nitric oxide pathway that helps blood flow, and many men find it useful before intimacy or practice. An advanced performance blend that combines Icarian, Tonkat Ali, fenugreek, nettleroot, and citrulline is designed to support blood flow, stamina, testosterone, and prostate comfort as part of a comprehensive routine. These are not shortcuts, and they do not replace technique, consent, medical care, and connection. But they can complement what you are doing in the bedroom while you dial in what works for both of you. Thank you for watching. See you in the next video.